Dear colleagues, Judith and other colleagues from the Education Global Network meeting in New York, greetings from Montenegro. I'm really happy to join you today to present a little bit about why violence and adverse childhood experiences are potentially as much of an indicator of lifelong inequity as is poverty and other forms of inequity. And I'd like to start today's presentation with a very short film.
Sometimes someone hurts you so bad.
I don't think you understand.
It stops hurting at all. Until something makes you feel again. And then it all comes back. Every word, every hurt, every moment. How could you ever understand where I come from? Even if you ask, even if you listen, you do not really hear or see or feel. You don't remember my story. You haven't walked my path. You haven't seen what I've seen.
I'd like to ask all of you in the room to look at the list of adverse childhood experiences on the slide in front of you and to tell me how many of them you think the girl in the film experienced just in that 2 to 3 minute clip. At the very minimum, it would be 4 or 5 of those. And if we look at a classroom, your average United States classroom, if we look at it through the lens of adverse childhood experiences, it looks something like this. This comes out of a study that was done in the mid-90s involving 17,000 recipients of private medical insurance. It was called the Adverse Childhood Experience Survey, and it was a subjective analysis about what percentage of the adult population had experienced violence, abuse, or neglect, and other forms of adversity during childhood. And what we learned from this survey correlates very much with what we've learned from the recent UNICEF global study on data called Hidden in Plain Sight, which reveals that violence, neglect and abuse of children is much more commonplace than we previously thought it was. And findings of the research also correlated with other study and research on adversity. For example, the Adverse Childhood Experience Survey of the 90s found that almost 22% of respondents had been victims of child sex abuse. This correlates very much with the research of the Council of Europe on Europe, where 1 in 5 children are said to experience some form of child sex abuse. But what we also learned from this study was a direct correlation between adverse childhood experience and poor lifetime outcomes. So in a way, you have an equity line between people who have low adverse childhood experiences and those that have high. So for example, somebody with an ACE score, an adverse childhood experience score of 4 or above, is 46 times more likely to suffer from depression than a child with an ACE score of below 4 or 0. Similarly, they're 30 to 51 times more likely to have attempted suicide. men who have a ACE score of above 6 are 46 times more likely to inject drugs. You see negative health outcomes in every single health indicator. A California-based medical doctor, Nadine Burke-Harris, looked at education outcomes against ACE scores and found that children with an ACE score of more than 4 had a 51% chance of being diagnosed with behavioural or learning difficulties in school, whereas children with an ACE score of 0 had only a 3% chance of being given such a diagnosis. So epidemiologists were able to detect a very clear correlation between high scores of adverse childhood experience and poor life outcomes. But it was the development of neuroscience that enabled us to understand more about why that may happen. And one of the drivers that neuroscience helped us to understand for this link between adverse childhood experience and negative life outcomes was stress. When we talk about stress in childhood, we talk about 3 types of stress. The first type of stress is what we call positive stress. And it's where children actually develop resilience through going through limited increases in the heart rate and mild elevation in the stress hormone levels through things like examinations, through challenges and through puzzles, but where all of that stress occurs in the context of a loving and caring, protective family environment. The second type of stress that children may face is what we call tolerable stress, where bad things happen to children. Maybe children witness violence, maybe children live in poverty, maybe children live in the middle of a conflict zone, but where that stress is buffeted and the child is protected by a loving and caring family environment. It's the third type of stress in childhood that we're really concerned about, and that's what we call toxic stress. And that's where the stress response system is elevated for an extended period of time, and the child is not protected or buffered by a family environment. And it is this type of toxic stress that we're learning has a really strong impact upon the physical development, the immune system and other aspects of physical well-being, but also in terms of brain development, because that type of toxic, prolonged stress has an impact on the development of the cerebral cortex, of the limbic system, and the brainstem, which are all essential for helping children to develop, to learn, to thrive, to build relationships, and to coordinate their lives and respond to the many challenges that they have as they go through the life cycle. In addition to that, children that have been victims of adverse childhood experience with high levels of stress are much more likely to have a sense of high anxiety and a view of the world as fundamentally a hostile place. And this is particularly concerning when children reach adolescence, and that's because 2 different systems of the brain which need to work in tandem are out of sync. The socio-emotional incentive processing system through which children respond to the environment around them is fully developing in the early teens, really. But the cognitive control system, which enables children to effectively manage and make judgments about how they respond to those kind of incentives, is not fully developed until the early 20s. It's very interesting reading the news in the United Kingdom that many of the young people that are going off to join ISIS, the Islamic State, for example, are not coming from religious Islamic backgrounds. Often they're coming from backgrounds of high crime and adverse childhood experience. And it shows that the judgments about joining something like ISIS, joining a gang, getting involved in crime, may be deeply, deeply affected by a potent combination of adverse childhood experience and adolescent brain development. IQ stops growing at some point in middle childhood, but we have neuroplasticity. The brain is much more adaptable and able to develop in other areas than we ever thought it was before. So One of the ways that we can help children to overcome adverse childhood experiences and build successful lives is through resilience, developing resilience and promoting non-cognitive skills, which also can be described as core competencies or character skills. Things like optimism, motivation, zest, curiosity and perseverance, grit, and of course integrity, which help children and young people to make much better decisions about their life and to continue to push on and try and advance even when it seems that everything is against them. Indeed, non-cognitive skills are seen to be increasingly an important part of education in general, and there's a growing view in education that character education and non-cognitive skills can improve dramatically cognitive performance and testing and so on over time. The other areas that we can work to help young people overcome and heal from adverse childhood experiences through developing positive attachments and addressing issues like detachment disorder and self-esteem. We are working in Montenegro to develop non-cognitive skills training we're piloting it in schools. It's not specifically targeted at children that have had adverse childhood experiences. It's targeted at children throughout the education system, but we think it will have a positive impact on children that have high ACE scores, and we will keep you posted on developments. Thank you very much.